Hello, everybody. Coming from Laguna Beach, California, this is Dr. Laguna. Today, I wanted to discuss with you all paradoxical adipose hyperplasia. This is a condition where all of you out there who've tried the cryolipolysis or CoolSculpting may have noticed bulging of the areas that you were treated for. Here you go. You're going in to get improvement in your contour, and then with a little bit of moderate weight gain, you're noticing bulging of the same areas that were treated. And you're like, what? How could this have happened? Well, we have found the pathophysiology as well as definitive treatment, and I wanted to share with you all today how this happened and how it can be definitively treated. So what's going on is when you get cryolipolysis, it's burning and freezing and killing that superficial layer of fat. We actually have two layers of fat in our body, the superficial layer, which is thinner, and then the deeper layer that is more dynamic. So what's happening is cryolipolysis utilizes paddles that are placed on the skin, and it tends to burn and kill the superficial fat. And your body then will reabsorb that fat, and you'll notice an improvement in your overall contour. Now, this may be great at the beginning. However, if you put on some weight, what is happening, and this is the paradoxical component, is that the fat that is underneath the layer that was frozen, the deep fat, actually grows preferentially to all the other areas that were not treated. Now, why is this the case? It is because of a concept called pressure apoptosis. Pressure apoptosis forbids other cells from growing and taking over and suffocating the neighbor cells. It is a condition that all cells live by. So what happens, in my opinion, and this is published in the Journal of American College of Surgeons in 2020 by our staff, is that the deep fat now that does not have that superficial layer has nothing to push against, and so it freely grows, and it grows preferentially to the neighbor fat cells, thus creating these bulges called PAH. Now, how do we treat this? A lot of patients have gone back to their cryo center and said, hey, this is happening, and they've recommended further cryolipolysis. This, in fact, is the wrong thing to do, because now you're going to remove even more of that superficial fat, thus allowing that deeper fat to grow even more prolifically if you put on some weight. A lot of people have gone to their plastic surgeons in the community and asked them to lipo this area. The problem is traditional liposuction utilizes these cannulas, and the cannulas can only be put into the deep fat. So we have a situation here where your providers may be trying to lipo this out, and traditional lipo also has a limitation of being able to only remove a little bit of the fat. So not only are you removing a little bit of that deep fat that has grown, but the adjacent areas, you're only able to remove the deep fat because the traditional cannula cannot go into the superficial fat. So now you're getting this disjoint in areas and contouring because one spot that was treated with cryo has no superficial fat and a little bit less deep fat, but the neighboring areas have all of their superficial fat still in place because traditional lipo can't eliminate it. And so you get this disjoint contour effect. Now, I'm here to tell you that we have the definitive treatment for PAH, and this involves using ultrasound-assisted liposuction, i.e. Vaser is the company that does this for us, as well as Renuvion subdermal coagulation, which is a novel combination of two technologies or energies called helium-activated plasma technology and radio frequency that allows us then to eliminate the skin redundancy. Remember, when you get these bulges that are forming, it's not only the fat in there, but it's also the skin that has been stretched out. Now, ultrasound-assisted liposuction works by melting or cavitating all the fat in both the superficial and deep layers, which gets melted. And the probes for the ultrasound are thin enough where they can go into both the superficial and the deep. Then we use those old conventional, traditional liposuction cannulas to siphon the fat out. We remove not only all the deep fat, but now we're able to also remove all the superficial fat. Here's the end all, guys. You got to remove both layers, the superficial and the deep, from both the treated areas with the cryo, as well as the non-treated areas. You basically have to bring the playing level down to a single level that has no fat, period. That is the only way we're going to be able to help you definitively treat PAH. And then on top of that, we add the Renuvion skin contraction technology to tighten the skin back up where it was bulging and it had slack. So there you go. We have a definitive treatment for PAH for all of you who've had cryolipolysis and noted these bulges growing on you and you didn't know what was going on. If you can't lose the weight, I have the solution for you, PAH. Please contact us for more information. We can do virtual consultations during these times of trouble with Corona, and we will help you get scheduled when the conditions are better. Thank you all, and hope you have a wonderful day. Bye-bye.